We begin with our first real taste of the return to normal. The CDC now says fully vaccinated people can get together in small groups, no mask required. It's the question everyone has been asking. What's reasonably safe for fully vaccinated people and what isn't?
Off the top today at 5, the CDC releasing its highly anticipated guidance on that all-important issue. Dr. Frank McGeorge here with a closer look at what the CDC is calling an important first step. Frank?
Yeah, Kim and Devin. So they're calling it a first step because the guidance will be updated as more people are vaccinated and as we learn more about whether the vaccines can also reduce the risk of spreading the virus. As we expected, the guidance is conservative, but it does provide a roadmap for those who are fully vaccinated to begin seeing other people.
The easiest scenario involves people who are all fully vaccinated.
CDC recommends that fully vaccinated people can visit with other fully vaccinated people in small gatherings indoors without wearing masks or physical distancing. Remember, here we are talking about private settings where everyone is vaccinated.
It gets more complicated when some are vaccinated and some are not.
CDC recommends that fully vaccinated people can visit with unvaccinated people from one other household indoors without wearing masks or physical distancing, as long as the unvaccinated people and any unvaccinated members of their household are not at high risk for severe COVID-19 disease.
That means no one in the unvaccinated household is over 65 or has underlying health problems. If anyone from the unvaccinated household is at high risk,
everyone, regardless of vaccination status, should still wear a mask and physically distance and choose to meet outdoors or in a well-ventilated space.
Those same precautions are also still recommended when fully vaccinated people gather with unvaccinated people from multiple households. As for quarantining,
CDC's new guidance also recommends that fully vaccinated people do not need quarantine or get tested following a known exposure to someone with COVID-19 as long as they are asymptomatic.
the CDC says the fully vaccinated are still advised to avoid medium and large gatherings, avoid non-essential travel, and continue to wear a mask and social distance in public places.
Now, a reminder, the CDC definition of fully vaccinated means at least 2 weeks past the second dose of the Pfizer or Moderna vaccine or 2 weeks past the single dose of the Johnson & Johnson vaccine. Although I do want to stress the clinical trials actually found the protection from the J&J vaccine goes up after 4 weeks. So personally, I would use that as my own guideline.
It's a lot of asterisks involved here, Frank. So why not change, you suppose, the travel guidelines for the fully vaccinated?
Well, you know, the CDC director said they are really trying to discourage travel because every time there's a surge in travel, there's a surge in cases. Of course, travel is a time when people from other places are mixing a lot, and that also helps variant spread. Now, she did say they're hopeful that the next set of guidance will have an update on travel for the vaccinated once more science is available to guide any of those changes.
A lot of hopeful travelers will be hanging on that word, too. All right, Frank.